Ah.
Hello, everyone. Welcome to JH Show. I am Javad. With me is Amir, and Hassan again is missing today. And we have a very honorable and distinguished guest from England, and Stewart. Welcome, Stewart, to the show.
Thank you very much. I'm glad to be here.
Yeah,
Just
let me. Yeah, Stewart, thank you very much joining us. And we have Jawad with us. And normally, what we are doing on every day at 7:30 PST, Pakistan Standard Time, we are coming online. This is just normal show, is a chit chat show to understand the people and the current condition of different countries. We have show where we have asked one Pakistani guy who are working in Portugal. So he came here and he explained what is going on in the Pakistani community over there. And yesterday we have one guy from Dubai. And thank you very much to come here. And we know your specialty is the supply chain. So we will talk about more. And I need your promise as well. Maybe after next week, you will come back and we will talk about more on the supply chain if someone want to be start career in the supply chain.
Sure.
So how, Stewart, how things are COVID-19 is treating in UK?
Well, we're just climbing to the top of the graph as they describe it at the moment. So we've had nearly 1,000 deaths a day for the last week. I think it was 894 yesterday. And the disturbing thing, I guess, that people are noticing is that first of all, it was people from a very specific demographic. They tended to be older males with underlying health issues, and it's kind of affecting young people, young, fit, and healthy people. So there's a degree of concern in that area. You know, probably our most recognisable patient at the moment is Boris, our Prime Minister, and he was submitted to hospital on Sunday with breathing difficulties. He has responded well to treatment. He's not been on a ventilator, and he apparently today is sat up in bed conversing with the NHS staff, and he's had some visitors because he's still in charge of the government as far as the cabinet are concerned. And I think that in terms of our government response, I think everyone's a little bit startled by where we are. Yeah, so we're on lockdown just like you guys. We can only go out for an hour a day to do some exercise, or to go to the pharmacy to get medicines, or to the store to get groceries. And when you go to the store, it's quite an alien experience because they conduct you in a queue with people standing 10 meters apart. But in terms of the food supply chain, seems to be working well. We have in the UK. We have deliveries direct from grocers, greengrocers. The delivery slots have been assigned to more elderly people, at-risk people. So you tend to see all the deliveries going to the vulnerable groups, and people like me have to go to the store and stand in a queue. And they're all well stocked. I think the only things that I found difficult to buy last week, excuse me, was flour and eggs and baking kits. Everything else was freely available. In terms of our supply chain for food, we've got a very well established network with regional distribution centres for all of the major supermarkets. So if you look and you're prepared to be patient and wait, you'll get what you need. There was an issue in the early days of people panic buying sort of fresh food, toilet rolls of all things.
Here is also the panic when the government is going to start the lockdown. So people are very worried about that, because maybe they did not understand before what is mean of lockdown. Maybe they are thinking it's look like the curfew. So the people in the queue, big queue, they have already on the grocery store and some other thing. But now things are normal. But still, I have seen in the morning time in the social media. I'm not going outside, but we have seen from the social media, and friends are sending some videos and picture. In the morning time, is still the people are going out and they want to buy in the morning. But I was thinking on the lighter note, it's not that the corona is only impacting in the evening or afternoon.
No, it's right. Yes, all day. Yeah.
So
all of the time.
what is the logic behind in the morning to go over there? So,
well, I guess the logic is that most retailers, food retailers, receive their deliveries before the store opens.
yeah.
So the stores will be well stocked at the start of the day. But most big superstores have their own little warehouse. So people just want to get their goods and then go home. I think we've had issues with defining what's an essential worker and non-essential worker. So all of the stores are closed apart from pharmacies, sort of food shops and takeaways. Yeah, so that's all that's open at the moment. So you see pictures. I mean, I've just been out to get some medication, and the big queues outside the fresh fish stores and supermarkets like Waitrose and Sainsbury's, but everything else is closed. It's quite eerie.
Stewart, I would like to know what on the government side and the public sector are the non-government organizations that are charitable organizations are doing in public awareness. What steps they are taking for the public awareness?
Yeah, so they come up with a slogan, right? It's that goes, "Stay inside, support the NHS, and save lives." So they're actively trying to get people to socially distance, but there are still a lot of young people. We're all young ones who still want to get together, party. The weather in the UK has been fantastic. It's 25 degrees here today.
Oh.
Yeah, there's not a cloud in the skies, and it's a religious festival weekend. It's Easter.
Young people like you.
Young people like me, of course. Young people like me. So people want to get together, have barbecues. We've closed all of the churches, and so I guess there's no mosques open, no churches, and at this time of year, people will tend to go, just like at Christmas time. People who don't usually go to church will go because it's Easter.
Yes.
So people will find that difficult, and again, like Friday prayers, people will find that difficult as well.
Yes.
So it's been uncomfortable for certainly the older generation. The younger generation just need to understand that these are some rules that they need to follow.
But certainly, Stewart, when someone is young like yourself, people feel good to break the law and do whatever they wish to. This is the another part of my question is how NHS or the government is ensuring a good mental health of people in the UK. I mean, I was just going through an article by an American psychologist, and which says that the corona graph would go down, but then we would see a lot of psychological conditions coming up with the people. How NHS is taking care of that and ensuring that people are in good psychological health?
Well, at the moment they are concentrating on providing enough intensive care beds and respirators and obviously on our side of things, oxygen. So we always have a problem in the winter with winter brings its own challenges in the UK because it's usually not very cold, but cold enough for you to get an infection. So we see a peak in the winter with older people having to go into hospitals on respirators. Now the whole point of trying to manage the curve, as they say, is just to push it into the summer when some of these issues that we get anyway will not be a problem anymore. But in terms of what they're doing for beds, they have opened a number of conference centres and sports stadiums. Yeah, they're calling them the Nightingale hospitals. Yeah, okay. After a famous nurse, Florence Nightingale, who was in the Crimean War. And they've provided the Excel Centre in London, which is quite a big conference centre. They've made 2,500 beds in there, just ICU. And BOC, who's the UK part of Linda, have been heavily involved in that, putting some vacuum insulated tanks in and sorting out the supply for that. There's also plans for another 17 of these conversions to take place across the UK, which will phase in if the curve doesn't fall away. So they're working on. So our hotspots are London, that's where the Excel is. Birmingham, where we've got quite a big Asian population actually in Birmingham. So they're converting the National Exhibition Centre for 1,500 beds. In Manchester, so there's again, it's a concert hall. They're going to put 1,200 beds in there. So they're working on that. So in terms of mental health, right? So we're being encouraged to, as a community. So we've got Janine, my wife's father, with us. So before the lockdown, we brought Janine's father down, who's 73. Otherwise, he'd be on his own because he's a widower. So you tending to find you're pulling your family in before the lockdown, and there's one guy who lives on his own on our little part of the estate we live on. So when we see him, we're talking to him, asking if he wants some groceries bought for him. So it's returning to how communities were many years ago when I was a child. I think we're helped out by things like this. Social media, so you can keep in touch with. So I've got two daughters. One lives in the north of England, and one is in Spain at the moment, working in Spain. So I keep in contact with those guys on WhatsApp. Last night we had a virtual quiz, right? So someone hosted a quiz, and there must have been 30 couples, 30 people on this Zoom meeting that we had. So it's things like that. You can do very practical, simple things to overcome that. I mean, I guess the downside is I've got you might have met him actually, Amir. Ian Rennie, do you remember Ian?
Yep.
Well, his father died last week. He had dementia, so it wasn't coronavirus. So he'd be getting more and more poorly over the last 12 months. So but he can't go and see him. He can't. The funerals have been limited to 5 people.
My God.
Yeah, and just like you in the UK, there's no examinations for O levels and A levels, so the teachers are going to go.
Emotional things and other things has already got away from this disease. Okay, Steve, your country capita per income is a little bit higher than what we have in South India. So, but we have discussed yesterday a long debate, the hunger and some other people who are working for the daily wages. It is very difficult to survive because we are going for lockdown, and I don't think so it can be lifted out easily because of the chain action. Otherwise, it will be started again. So what is in UK you are seeing is that what type of issues you guys have? You have also the same thing, the problem of the financial issues, and how government will be thinking about that to resolve?
So we do have poor people. It's all relative. We have homeless people who live on the streets, but as a UK sample, so what we've tried, what the government have tried to do is get these people indoors. All right. They've also provided financial support for the most vulnerable people by increasing their benefits, their income. They've also provided support to let people, let businesses furlough staff and pay up to £2,500 a month of their salary, so the business doesn't fold and make them redundant. A lot of the guys who we've had. The NHS asked for volunteers, right? And they were looking for 100,000 people, and they've got 1 million people who volunteered for the NHS.
Oh,
right. So these guys, some of them are taking food parcels out to the most vulnerable. Driving people to shops, working in hospitals, making beds, cleaning. And we've also had, I think it's 15,000 ex-NHS workers, doctors, nurses, surgeons who've retired. They've come back on the front line. So, the government of, there's not, put it this way, there's no political distinction between what the government's doing. It's done what it thought was the best in circumstances. And you would hate to be a prime minister in this circumstance, I guess. But we're doing what we can, and we're learning every week. We're just trying to we're just trying to support people. It's not helped by. I mean, it's helped and it's hurt by social media, because you've got the ability to talk, but then you go on an internet news channel, and it's all about death and negative things. There's not many positive stories.
Yeah.
No. Stewart, coming from the supply chain background, I have a question for you. Number one, how do you see this coronavirus lockdown impacting economy in coming months? I mean, the lockdown was, and number two, right now the supply chain is very difficult right now for anything, be it the product or be it the service. Flights are closed, things are not moving here and there. But do you see that it would change the way we do supply chain in future? This lockdown and this corona, would this impact the way we conduct the supply chain business?
From a UK perspective, I think that we have quite mature networks. We have a very small geography. It's like the furthest away from the sea you are is 90 miles. So although we have some places that are quite sparse in population, we're a relatively small island with 67 million inhabitants. Okay. So for us, I think that we'll not see any lasting changes from the supply chain perspective. I think that we will do more online, though we do quite a bit anyway. So we have had online grocery deliveries, and I probably would do it if I could get a slot now. But in terms of gases and things like that, I mean, I don't think we can do anything different. We've got quite a. I guess it's different in Southeast Asia. It's quite different because you're evolving, growing all the time. So you just have to grow with the population grows, and we've got no super cities. Our biggest city's got 12 million people in it. Whereas you talk about India, Pakistan, you've got 30, 40 million people in it.
Yes, Karachi we have.
the ones you can count. Yeah. So I think that. I think the issue that the guys will have in who are low incomes in Southeast Asia are they're used to doing a shop daily, and it's a whole social thing. So they'll go and get their groceries for the day and cook their meal and then do it every day. But I think what we might find in the lockdowns, because of the lockdown, is the frequency of purchases will reduce.
Reduced.
Yeah,
Yeah,
and even though
I was discussing with one of the friend who is now working in e-commerce. He is vice president in the one of the biggest brand. So I just discussed in the morning. I asked him to come and to talk about. He say, I'm too much busy, Amer. I cannot spend my time. I said, why? We are after the office time. We have some time to discuss another thing. He say, now the booming is e-commerce is booming a lot because everyone is ordering online and some other activities is going on, so we are too much busy at this moment. So e-commerce, I think in the future as well, so it will be more booming up for the especially the grocery and some other activities. For example, it's not all essential other things like gases and other activities, but it will be take little bit different shape in the future maybe.
Yeah, and I think for your weekly shop or your grocery shopping, I think we in the UK will have less waste. Yeah, so you buy, you're only allowed to buy what you need at the moment. There was a big thing in the newspapers this week about the people who bought, when the lockdown started 2 weeks ago, the people who bought the fresh food bought too much and they're throwing it away now. Yeah, so I think that what this will teach us is that we should order what we need to survive as opposed to order what we want.
It's also
Stewart,
go on.
This is another very good learning that you just shared. That order what you need, don't waste it, because we don't know where we are headed. Things are very, very unpredictable. For the first time, Stewart, I tell you, I went through the McKinsey's report, and it had no strong and quantitative analysis. It all have all qualitative discussions. This is for the first time I have seen. So people are unaware of the future. The data is not supporting them. The analysis are not working. It is altogether a different world that we are headed to.
They're learning every day, and I think that now we're seeing the level of mortality that we're seeing is now we can understand why the governments have put lockdowns in place. They obviously knew a lot more about the disease
than we do
before we did. So I think there's quite a few things that will change from a social perspective after this. So for example, the whole episode has taught us that people can work from home. So we've got schedulers, planners, sort of regional managers, all working from home and using digital media as it was intended to do. So you can work. It's much better to be face to face. You can gauge the emotions, etc. But if you need to, you can work from home. So I think that perhaps in 5 years' time, offices will be smaller. Yeah.
Yes, that's what we are headed to. One question that, Stewart, that I have another from coming back to your stats. I was going through England stats, UK stats, and these are not very good numbers that I've seen. I have seen that the total deaths in UK so far has been 7,000, but whereas the total recoveries are only 135. Can you, because you are there and you are seeing all sort of newses and hearing people saying things, the specialists and experts, what do you think, or as far as your knowledge is concerned, what reason is there for these two numbers? I mean, death rate too high and recovering rate too low.
Yeah, well, so I benefit from a background in this kind of analysis, in the fact that my undergraduate degree was in human geography, so we learned a lot about demographics and I mean, if you break down the numbers, the numbers itself, they're not massive. So let's say we've got 10,000 deaths. They did some analysis the other day, and the fact we've had 5% more deaths than we would have had in a normal winter. So perhaps we're having people infected by COVID who subsequently die, who would have got pneumonia and died last year, let's say. So that's 5% extra deaths based on the normal run rate. If we look at infections, and recovery, so they're only measuring recoveries in the fact that they've been into an ICU unit, and then they've come out the other side. So from that you can learn that if 11,000 people go into an ICU unit, then 100 people will survive. So that'll be 10% survival rate from ICU. The infections are only people who've been tested, so we don't know how many people are infected, and the death rates, etc., are only based on hospital stats at the moment. So you may have the people who, I mean, you see it on the news every day, people who've been self-isolating at home, they could succumb to the disease, but it doesn't get onto the figures that are published. There's a bit of a lag. So I think that there are, people who've been tested and found positive with COVID have not even felt ill. Some people,
It's asymptomatic.
Yeah. So, and then you've got other people who, collapse in the street and die within 2 days of contracting the virus. So it's a massively unpredictable contagion. So I think that's why people are so worried and excited about it in that respect. So I think the stats next year, when this is all over, will make a lot more sense than they are at the moment. And one of the criticisms that the government have been receiving of late is that, so we have a briefing at 5 o'clock every day, and there's when Boris was fit, Boris would do it, but he's deputized it to one of his cabinet ministers. And on one side you have the chief medical officer, and on the other side you have someone who deals with trends, stats, and analysis. And they're being criticised because they're listening to the people who are modelling the disease, and there's no disease like it before. So we just don't know where we are or where we're going to get to.
So, Steve, what do you think is there, because we are going to end of the broadcast, is there any hope you can see from this?
I think
talking 3-4 days, what is going on? Everyone is talking about so much negativity. What is the hope you can see here?
We'll come out the other side of this. Yeah. So some of the weak may be unfortunate to succumb to the disease. There'll be random cases from non at-risk people as well, but we'll come out the other end and we'll learn from it. I think the view is that COVID-19 will be with us for some time. It'll be like the influenza virus, so it'll pop up. I think we'll have also seen in every country, every country that's locked down, that when they have leadership, we can change our behaviours quickly, and we just need to be aware of that in the future when we have similar outbreaks.
So we have the question. He's a healthcare guy. Saeed Abbasi asking, is this happen due to weak immune system?
Well, I spoke to someone in the yes, people with weak immune systems will be vulnerable to this, but also people with very strong immune systems, because some of the early deaths were related to your body being destroyed by your antibodies, your white blood cells. I've heard that there's a strong link between obesity and succumbing to the illness, and because it's a respiratory problem, if you're a smoker, if you've got underlying health issues like asthma, emphysema, then you're more at risk than anybody else. So immune system, we are in the middle of nowhere.
This guy is very good. He joined us in the yesterday discussion, and very good questions and feedback from him. So he's asking, looks like we are in the middle of nowhere.
Yeah,
exactly.
Yeah, you can't. I mean, initially they were comparing it with Spanish flu. Yeah, we're light years in every country away from the Spanish flu times. It's 100 years ago, but we just don't know what this will do. I'm very skeptical about the information that's coming out of China as well. It's such a populous country to have so few deaths. There's something wrong there, I think.
So Stephen, people are thinking you are a doctor. So one question, our good friend Nasrullah Bhat is asking, what's update regarding its potential medicine and vaccine? Do you know about that?
Well, I can only say what I've read in the newspapers, and in the newspapers there are several things that are being tried. One, because it's a virus, they're looking at AIDS medication, the antivirals, which are showing some success in patients that tried it on. There's also a malarial drug, which I can't remember what it was that they're trying as well.
What do you know about the name?
It's hydrochloricrosazine or something. It's a big long name.
Hydrochlorine.
He can tell us because he is
hydrochlorine.
That's it. So they're trying that, and they've had some success, but it's not shown success across all patients. And they're also, the biggest success they've had in the UK is taking plasma from cured people, and putting and injecting the sick and ill.
Yes.
But there's
Stephen, on this note, I just want to inform all the viewers that Pakistan has started its final stage of vaccination or trial of a medicine. There's a university named University of Health Sciences, Pakistan, and the principal is Dr. Javed Akram. He is testing his medicine on 520 people. It's in the final round of trials.
Okay, let's Chandan has already given the medicine name what we are telling, and Saeed Abbas is actually from the healthcare industry as well. So he's saying no vaccine approved by FDA yet.
No, I don't think that. I think it's all in trial stage at the moment. And one other thing that I read yesterday is that Bill Gates was donating $6 billion to try and fast track a cure.
But Steve, you know, the FDA and FDA has a very long process to approve any medicine. It has a long chain of trials, and then there are hypotheses and theory, and then scientific methodology, and then the clinical research and the outcomes. They observe at least 18 months the reaction of the human trials. So it's a long process. This disease just started, so we don't expect them coming up very soon. Violated.
Yeah, it's very difficult, and also is it difficult for testing because they don't have the kits. Still we don't know what is the major contributory and how many people more are affected. What is the scale of that? Still, we talked about yesterday as well. So how many people more? So I was reading something. I'm not sure we need to share here or not. It's a good suggestion. It's look like in my mind it's a good suggestion, but I'm not a doctor. I cannot tell. So you say, okay, you take the 16 people or 20 people. Okay, all the blood just mix up and check if there's any coronavirus symptom or not. If not, it means the 20 people has already there's no symptom of the coronavirus. Okay, so they are clear. If they are 20 people have something, so you need to go for even basis. So there is some statistics you can say that you need to use or something. I'm not sure is the right thing or not. So
this must be a computer guy, data analysis or data engineer.
Well, in simple terms, that's what they do, isn't it? So they find a cured person, and then they take their antibodies and they turn that into a vaccine.
Steve, famous today because we have a lot of questions coming in. Does the government has any strategy of testing people who are continuously staying or isolating themselves at home? Maybe it's about the Pakistan. So, Jawad, do you have any answer for that?
Yes, Salman, see, government, of course, has established a few testing laboratories. Right now, they have 16 in number, and they are moving in towards making it 50. So if anybody who is isolating itself, there are 3, 4 tall numbers. You can call them. We can put those numbers with in our comments. So you can call those numbers, or whoever feels of a symptom or anything like that, who has a travel history, he can call on that number. They would come in, they would take the sample, and they would test it. So that is the strategy right now. It has been widely announced by the government through the media channels and through the hoarding boards, radio stations, and everywhere. So if anybody who feels they have a symptoms in Pakistan, there are 3 or 4 numbers. The one UAN number is 1166. They may call on that number. People would come down, take a sample, test it. If it comes positive, they would take him to the quarantine, and if it is negative, they will leave it the way it is.
Good. So he's our good friend from India. He's working in Malaysia. So today onward, government of India supplying this medicine to US.
Hydroxychloroquine to US. Yes.
So Donald Trump has also thanks to.
Amir, I guess we just ran out of our time. We overspent almost 6 minutes.
Okay. It's okay, so, no problem. Let's have a comment. So, self-medication may be harmful. I think we will go a little bit for.
No problem. That's all right.
Stewart, and you are available, then is okay. If people are interesting to listen, then is okay.
Yeah.
Okay.
I've got some more time.
Yeah. About having kits, which is only one and FDA approved.
Okay. Thank you.
Yeah, in the UK, in terms of testing, what we're doing is because of the limitation of kits that are currently available to us, we have mobile testing stations that we're focusing on the healthcare professionals first. So we're testing all our healthcare professionals, and then we'll be moving on to more the more vulnerable people in society. But we're anticipating to go to. We've tested about 250,000 people so far, which is not a lot. But we've been waiting for kits from China, so we're kind of behind the curve, and that's what the government are getting a lot of criticism on that at the moment.
Yeah. Okay. So Saeed, thank you very much for sharing. I will love to host you maybe tomorrow, after tomorrow, if you are available. So please join us in discussion. So you can also, because I know you are more healthcare in the industry as compared to us. Thank you very much for your feedback and comments. Okay, Stewart, do you have any comments for the people of Pakistan or your people who are listening you?
Yeah, well, I'm trying to be as positive as I can, and I think we've talked about mental health and caring for the loved ones that we have around us. I think we need to keep one eye on the future. It's very worrying times. No one likes to have their social privileges restricted, but we will get out of this, come to the other side, and learn a lot in the process. And thank you for inviting me to your little show. And yeah, of course, I'll book me a slot in a week or so, and I'll come back and have a chat with you again if you like.
Yeah, please. We love to host you again. And what we are thinking about that, as if Jawad and Hassan is my co-host, we are thinking about to connecting the people from the other countries, so our Pakistani colleagues and the friends also can listen the other people perspective, and especially the supply chain, because we have the experience of supply chain. So maybe you can guide our guys in Pakistan if they want to start the career, how they need to start, and what is the benefit to be in the career of supply chain, and how the supply chain is working, what education and what things is there. So I think we love, because we have planned to share the knowledge. This is our attitude. We are not thinking about how many people are watching and how people are doing. Our perspective and our aim and cause is people can understand, and whatever the knowledge we have with our friends, we can deliver to the other people who cannot have this type of facilities. So this is our cause, and I'm pretty much sure you will help us in this cause.
Okay. Well, thank you very much.
Jawad, any comments last? Then we will be close.
Uh, First of all, Stewart, it is our honor that we are hosting you today. Uh, Valuable input that you have enlightened us. Thank you very much for telling us what is England going through. You really have been positive and gave us a very positive energy, not only to me and Amir, but to our viewers only. We from JAH show platform wish you, your two daughters, one in North England and one in Spain, a very safe and healthy life ahead. We hope that all we pass through these hard times safely and together. Thank you very much for joining us.
You're welcome.
For my viewers, today's positive note, whatever we are going through, it will end soon. We need to focus, and stay safe, stay inside. Thank you.